Hi everyone, I'm Steve Rogne, and I would like to share with you my experience using the techniques that you'll learn in Shiatsu Symposium 2017. I'm the director of Zen Shiatsu Chicago, and I've been in practice for about 15 years. And the first 12 of those years I practiced with my pretty much entry-level skill sets. I found that I was really quite effective in working with most routine cases of muscle tension and pain, this sort of thing. There were some cases where my results with Shiatsu were a little more hit and miss, particularly maybe spine issues like spinal stenosis or disc issues, or different kinds of joint dysfunction of the shoulders, hips, and knees. It just depended. I didn't find I could always get consistent results with some of these issues. I'd find myself looking to refer out to chiropractors or physical therapists in certain cases where I really felt like if I just expanded my skill set, that Shiatsu could provide an equal or even better solution. So about 3 years ago, I first started learning with Michael Diagro, who'll be teaching in the symposium. And Michael helped me learn how to adapt my method of touch to the sinew channel layer to touch in a way that gets the quickest results with contractile tissue. And he also taught me how to use my concentration and my senses in expanded ways that now help me immediately recognize patterns in the whole sinew layer. So for example, I now have protocols by which the client can imagine doing a desired movement that's difficult for them, and then I can use my senses of sight and touch to observe how their nervous system is attempting to coordinate that healthy movement, where in the sinew it needs to let go and activate in order to do that movement in a pain-free, integrated way. So this way of working has opened up a whole new range of effective outcomes for my clients and greatly increased my confidence level. So for example, one of my clients is in her late 80s, and the whole time I've known her has been very active, playing tennis twice a week. And a year ago, she suddenly developed major spinal nerve problems, like with severe foot drop and burning and pain and numbness in her legs and back after some overly aggressive personal training. And neurology reports diagnosed all sorts of nerve conduction problems in both legs and spinal stenosis, significant stenosis. And so for about a month, she was trying everything all at once. She was trying physical therapy and chiropractic and nerve injection therapies, and she was still stuck in a lot of pain. And this sinew channel approach gave me the confidence to recommend that if she wanted to continue Shiatsu, that we look at a 3-week course of just Shiatsu twice a week without all the confusing input of all those other therapies. And that proved to be a great solution. So very soon after discontinuing the other therapies and focusing on Shiatsu, her situation improved really quickly. She's since become completely pain-free. The foot drop has almost completely gone, and even her pre-existing amount of chronic back tension is almost entirely gone. So she's back to playing tennis twice a week, and she hasn't needed to resume any of those other therapies that she had in the mix. So I feel that the skills that I learned studying from Michael helped me to assist this client to create and sustain space solutions in her body that allow her to function with freedom even while the hardening and narrowing still exists in her spinal column. And I'm also very excited to be learning from Bob Quinn and Jeffrey Dan for the first time for me in October to learn their specific takes on coordinating structural alignment through the girdle vessel and the Shaoyang sinew. Through learning Sotai therapy, I'm expecting that I'll learn a lot of ways to integrate client-initiated movement in meaningful ways, both as a therapeutic intervention within a treatment and also for post-treatment follow-up. And Jeffrey will also share some really sophisticated ways of listening in a sensitive way to all the different layers, the tissue layers of the body, and integrating this all with our meridian and channel understanding. So I hope that you will join me in really developing our expertise with these structural issues and expanding our edge of what we know to be possible for our clients, and really getting that toolkit that will help us deliver consistent results. So I hope to see many of you in October. Thank you very much.